indeed, the figure was mentioned already. Normally, to produce a vaccine takes 5 to 10 years. And normally, the approval process takes approximately 6 months. Depends a little bit on the drug that is to be approved. So the reduction of the process down to 3 to 4 weeks, where we are right now, is already enormous. A big step forward. Important is the process itself, because these were completely new vaccines, the ones who are approved right now, so the mRNA or the vector vaccines. And it is in the interest of the people who are being vaccinated that there's a thorough understanding that this vaccine is not only effective but also safe. And therefore, this process is so important. But what we're going to do is look into the process without losing content, where you perhaps can better synchronize steps. And by that I mean we might change the regulatory framework to enable EMA to do that. With the view on the variants, there you do not need the whole approval process anymore if you have an updated vaccine, because now there is a bottom line knowledge on, for example, the mRNA technology, and you only need to look at what is the incremental improvement or change that occurred, and is that still effective, and is it safe? So there, I think we can reduce the procedure on top. Stella, you want to add something?
Yes, just very briefly to add, of course, on what the President has already covered, that we mustn't forget that we were dealing with totally new vaccines and vaccine technology, and this is something that needed to go through, of course, the safety regulatory framework that the European Medicines Agency provides. I want to also here say that the European Medicines Agency was having rolling reviews of the vaccines before even conditional emergency authorization had been applied for, and we used with the member states all the greatest use of the regulatory flexibilities available. In what we are discussing today, the HERA incubator, we are looking now at vaccines that may need to be adapted for the variants. So you are able to use the current way, the regulatory framework that was used, and just clear with EMA and the industry that they can do this with a smaller set, I would say, of additional data. So this is about now really modifying the way that the regulatory framework will be used if we're going to be working for vaccines which need to be changed, updated, or in any way to deal with the variants.
Perhaps I can take the floor again, and afterwards I'm going to give it to Thierry, but I have one more point that is important. What we saw in the data was a variety of quality, if I may say so, over the last month, and you followed up all the reports on the different vaccines with problems with the data quality. What means data quality? It's whether you compare apples with pears, or whether you have a standardized approach, whether all the age groups are included, all the different specifics of patients, potential patients are included. So we have been struggling a lot with that. And therefore, it's so good that we have now, as of today, the start of the clinical trial network in Europe, because then you have an automatic guarantee of a very standardized approach to testing these potential new vaccines. This is an adding factor too. Thierry had 1 point more.
Perhaps because you wanted some clarification on selection, etc. HERA incubator is really important because everybody would pool their efforts. And also, let me shed some more light on the situation, because I myself was wondering about this when I visited some of these plants and production facilities. And I heard that in many cases, the clinical trials started in the summer. And as you know, Europe was in lockdown. Almost all of Europe was in complete lockdown. And of course, the numbers of infections went down. And so for that reason, too, it took a little bit more time to gain access to all the testing capacities. That's also one of the things that slowed this process down. And now on the variants, because this is the main issue here, in all three types of technologies that we have available here, the messenger RNA, the virus, and the recombinant protein. The first one, the RNA messenger, is very promising because, in this respect, because if there are any genetic mutations, and what we are all thinking of now is the South African variant, for example. Of course, it will require some time, but only a number of elements will have to be modified without having to change everything in terms of the lipadic nanoparticles. Because otherwise that would be extremely complicated, because those nanoparticles will not have to be interfered with. So the new vaccine, which will have been developed for this variant, would take less time, because the only parts that will have to be retested are the fragments or the parts of the vaccine that will have to be changed, and not the entire thing. And what is of fundamental importance for us is to ensure health and safety of all our citizens, and we have very strict criteria, and that perhaps also slowed things down, but it is of fundamental importance.